Well, having a headache can make it very tough to get through the day. But to get relief, you need to know what's causing your head to hurt. Our Health Beat anchor Anne-Marie Tiernan's in studio today with the triggers and the treatment. Hi, Ann.
Well, hey there, Scott. For Ask the Doctor today, I'm joined by Dr. Steve Samuels with Franciscan on the South Side. And Steve, thanks for joining us today.
Thank you for having me.
So let's talk about headaches, something we all experience, but for different reasons. And there really are three broad categories.
Absolutely. The three most common sources of headaches are sinus headaches, tension or musculoskeletal headaches, and finally migraines.
All with different triggers and different treatments.
Absolutely. The most important thing is to realize it's probably not a tumor. A tumor is an extremely rare cause of a headache, usually presents with other symptoms. So the best thing to do is talk with your doctor, give him a good history rather than start ordering expensive tests.
All right, so let's start with the sinus headache. What would be the definition then of the sinus headache?
Sinus headaches frequently can be in the front of the face or in the back of the head. They're usually associated with some nasal congestion or postnasal drip.
And this moving side to side?
Absolutely. As the sinuses change in pressure, the headache can move from one side to the other, back and forth.
Okay, so let's talk about then what would be a good treatment for a sinus headache.
Simple over-the-counter medicines for like Tylenol or Aleve usually will help with those headaches. And then we have suppressor medications, medicines like antihistamines like Claritin or Allegra, or nasal steroids will help keep the frequency and severity of those headaches down.
Almost treating that like an allergy.
Absolutely. Allergies can be associated with sinus headaches.
Okay, and next let's move on to tension headaches. When we're talking about tension headaches, is this also like stress?
Absolutely. Tension headaches usually occur in the back of the head and into the neck, and they're associated with stressful activities or prolonged computer use. Prolonged exposure to bright lights can set the headaches off.
This is when we say we really just have throbbing in our head.
Absolutely. It's a throbbing sensation that usually patients describe.
Okay, so for this type of headache, the tension headache, what are the treatments that you recommend?
We usually recommend the anti-inflammatories. Aleve or Advil are very good at relieving these headaches. And then if the headaches are continuing and persisting, muscle relaxers are very good. Flexeril is a typical brand that we use, usually used at night because they can be a little sedating, but those will help kind of decrease the severity and frequency of these type headaches.
And we're talking about tension headaches. What treatments do you try to stay away from?
We try to avoid narcotics. Repeated use of narcotics for musculoskeletal or tension headaches can lead to what are called rebound headaches. As the narcotic wears off overnight, you wake up with another headache the next morning, you grab the narcotic again, and this can lead on to addiction. And so we really try to avoid narcotics in these headaches.
So that really is a cycle, but boy, when your head is throbbing, you're like, give me the strong stuff.
Occasional use would be fine, but repeated use can actually, again, lead to rebound headaches, which won't resolve until you get off the narcotic.
All right, now let's move on to the last and the big one, the migraine headache. What makes the migraine different than the tension and the sinus headache?
Migraine headaches are caused by a vasospasm in the brain and are different than these other two headaches. They're occurring centrally in the brain. The headache is usually one-sided, usually is associated with a prodrome, or prior to the headache coming on, you'll see flashing lights in either one or both eyes. They can be associated with a hypersensitivity to smells or tastes or sounds as well.
Okay, and then what would be the treatment for migraines?
Treatments, acute treatment, Excedrin migraine over the counter is a nice treatment and used in combination with a prescription medicine called a triptan. Imitrex is one of the most common treatments that we use. It's available in pills, it's available in melts that you can melt under the tongue because frequently migraines are associated with nausea, and even available in shot form.
Well, so Topamax, Prozac, beta blockers?
Those are the medicines to suppress the headaches. If your headaches are occurring more than once a week or limiting your day-to-day life, then we put people on suppressive headache medication to kind of keep the frequency and severity of those headaches down. At
what point do you go to the doctor and you self-treat?
Well, I think at this point, if the headaches are recurring or they're limiting your day-to-day function, that's the time to go seek medical advice and have a doctor help you decide what type of headache you have and what the appropriate treatment is.
All right. Thank you for this clarification for something that people of all ages deal with. Thank you.